early Monday afternoon was a beautiful day, but it was when we knew by Tuesday morning that there was flooding. Okay, this is different from hurricane threat. We have a real disaster, and everyone's going to have to be evacuated. Well, the number of patients was only about 100 patients at Tulane Hospital. We had the patients from the Superdome, but we had over 1,000 people that were either connected with the patients, they worked in the hospital or medical school, or that had evacuated to the medical school or hospital. So we used the top of an adjacent parking garage of the hospital to be the sort of helipad. So to evacuate the patients, you would have to put the patient on a stretcher to go downstairs in the hospital. By Wednesday, we had no electrical grid power and we had no emergency power. So at that point, everything is dark, the air conditioners aren't working, the temperature in the area is approaching 100, so it's a mess. Fortunately, we didn't lose a single patient. No Tulane patient died, which is a miracle on any given day of the week, much less in the midst of such chaos. For a few weeks, it's not clear what's going to happen to the students. What had been set up by Dean Taylor and by other of the school leadership is to work on a plan where students were at a variety of medical schools, predominantly in Texas, and the biggest site and the most helpful by far and away was the Baylor School of Medicine.
DeBakey spoke to us, and it was really, he's from Lake Charles, Louisiana, and he was very proud to have gone to Tulane, and he's obviously a bigger than life kind of character. He just tells stories, and it was very welcoming.
I was able to really, welcome everybody and position people in places. If you're a resident, if you're a first, second, third, fourth year med student, place you well so you had your curriculum, you had your teaching and going on.
The traditional delivery of service in New Orleans had been Charity Hospital and those clinics. And Charity Hospital had been flooded, and so that's not a possibility anymore.
It was actually our Tulane Medicine Pediatrics residents, so these are the doctors after finishing med school, who had already been on the ground and were able to reach me and ask for help and say, can you come help us open healthcare services? At some point, we're seeing 450 people a day, giving tetanus shots and checking on diabetes and writing prescriptions.
Went out and saw patients in the streets, had mobile clinics on buses. We developed a military-type hospital on the campus, I think at the LSU campus afterwards, and it's pretty incredible, It's a very unique opportunity to be part of history and some sort of unique healthcare delivery.
Spent the next few months just standing up healthcare services, moving from the street, getting into buildings, then turning those buildings that some became converted into full-fledged health centers. The one at Covenant House was one of the first sites where we stood up an ice chest and care for people. That is one of what has become some 80 sites across the community.
We attract students nationwide that are very motivated to provide care to those least able to afford it.
I have no family here, but this is my home. And I guess there's there's really no other way to describe it other than it feels like this is where I should be.
This is where I was born and raised, and it feels so good to be part of giving back to the community that gave so much back to you as a student.